Hello, my name is Jaden, and this is my audience. Today I'm going to be doing my speech on unaffordable healthcare. Imagine being sick and not just worried about your health, but terrified of the bill that comes with it. Imagine choosing between going to the doctor or paying your rent. For millions of Americans, this isn't hypothetical, it's reality. Unaffordable healthcare is a serious and preventable crisis in the United States that harms people physically, financially, and emotionally. And we must take action by expanding insurance access, regulating costs, and demanding transparency. First, I will show how unaffordable healthcare harms people. Second, I will explain why this problem continues. Finally, I will present solutions that we can support to fix it. The problem: Americans are being harmed. First, it causes physical harm. Millions of Americans delay or avoid care because of cost. According to the Centers for Disease Control and Prevention, about 1 in 4 adults report skipping or delaying medical care due to cost. That means serious conditions are going untreated and becoming worse over time. Second, it creates financial devastation. Healthcare costs are so high that around 70% of Americans' healthcare is unaffordable for families, according to the Kaiser Family Foundation. In fact, many families are forced to cut back on food, housing, or other basic needs just to afford medical bills. Third, it leads to emotional and mental stress. The American Physiological Association reports that financial stress, especially from medical expenses, is one of the top sources of anxiety in the U.S. People are not just getting sick, they are living in constant fear of what care will cost. Now that we've gone over why Americans are being harmed, let's take a look at why this problem continues. First, there is limited access to affordable insurance. According to the U.S. Department of Health and Human Services, about 26 million Americans remain uninsured and many more are underinsured. Even with insurance, high deductibles make care unaffordable. Second, there is a lack of cost regulation. The Common Health Fund reports that the United States spends more on healthcare than any other country, yet does not achieve better outcomes. This is largely because prices are not effectively controlled. Third, there is a little transparency in pricing. According to the Pew Research Center, a majority of Americans say they do not understand healthcare costs before receiving care. This makes it nearly impossible to plan financially or compare options. High prescription drug costs make the problem worse. The National Institutes of Health has found that drug prices in the U.S. are significantly higher than in other countries, putting additional strain on patients. After examining why the problem continues, we can now explore what we must do to fix this problem. The solution: what we must do. First, we must expand access to affordable healthcare coverage. The World Health Organization emphasizes that increased healthcare access leads to better health outcomes and reduced financial hardship. When people have coverage, they are more likely to seek care early. Second, we need to regulate healthcare and drug costs. The American Medical Association supports efforts to reduce excessive pricing and make care more affordable. Setting limits on costs would protect patients from extreme charges. Third, we must demand transparency in pricing. Patients deserve to know what they are paying before receiving care. Clear pricing allows individuals to make informed decisions and avoid surprise bills. We must use our voices. Public opinion shows that a large percentage of Americans believe lowering healthcare costs should be a top priority, according to the Kaiser Family Foundation. Change will not happen unless people demand it. Unaffordable healthcare is harming Americans every day, physically, financially, and emotionally. Millions are skipping necessary care, falling into debt, and experiencing constant stress. This crisis continues because of limited insurance access, rising costs, and a lack of transparency in pricing. Unquestionably, unaffordable healthcare is a serious and preventable problem in the United States that must be addressed through expanded coverage, stronger cost regulation, and greater transparency. Healthcare should not depend on how much money someone has. It should be available to everyone. No one should have to choose between their health and their financial stability. So as you leave today, ask yourself, if healthcare can save lives, shouldn't it also be affordable enough for everyone to access it? The time to demand change is now.